Jens' work. Now I would like to hand you over to Martina Quealy, who is the chair of the Eastern Regional Traveller Health Unit and Chief Officer in the Community Health Organisation 7, who will respond from the health services perspective. Okay, Martina, thank you.
Thank you very much, Bridget. Firstly, I suppose just by way of starting, I'd like to acknowledge in a very sincere way the current situation that the traveller community experience, both in terms of mental health outcomes and also in terms of general health outcomes for the traveller population. And also, I suppose, some of the evidence, you know, much of which I've seen before, but to have it presented again today in terms of traveller experience of engagement with health services and the potential negative impact of that on the overall health is, you know, just want to acknowledge that as a challenge for the health services. The second thing I'd like to do is to thank the speakers. The evidence presented today from all of the speakers has been really excellent, and I just want to acknowledge that both in terms of it being inspiring and motivating towards change, but also in terms of, as Ian said, holding the mirror up to all of us to sort of look at how we can do better and how we can improve. Third point I'd like to make is to recognise the need for the ethnic identifier, and I know Pave Point as a traveller health organisation has been working assiduously in terms of trying to progress that matter, and I do believe it is a really important element in terms of moving forward. It will provide us with a basis in terms of traveller experience and traveller health outcomes that really will underpin, I believe, service improvement and provide a very compelling base for policymakers and funders. So that's the third point. I suppose the fourth and final thing I'd like to say is I think today has framed in a really thorough and you know, excellent way for me personally some of the challenges before us that we need to address, and indeed some very detailed frameworks which can, I think, support us to address it at that meso, macro and micro level. I think for somebody who manages a fairly large organisation, that challenge of trying to ensure that attitudes, beliefs, and behaviours are addressed, you know, requires constant monitoring, really, and awareness by both senior managers and leaders in the organisation. And I think some of the points today in terms of how that can be done by creating kind of allies for health and that kind of cultural approach to really both acknowledging when something happens that shouldn't happen, and also constantly holding the mirror up as to how we can do better in our interactions. I think that's really important. But I do think the other important thing is that overall organisations like the Health Service Executive here in Ireland understand that their policies and their systems need to be underpinned by a desire and a willingness and a motivation to address these issues. And I suppose that's why things like the ethnic identifier are fundamental, really, in terms of progress. And I think the final thing on that fourth element is really finding and truly continuing to build on the partnerships, similar to the partnerships we have with Pave Point and through our primary care projects for travellers. I think that's really important. And you know, you spoke about COVID being a kind of real disruptor, and in actual fact, there's been you know, some things accelerated through COVID. So I suppose it is an ill wind that blows no good. But I think one of the things that some of us didn't need any convincing, but if anybody did, one of the things that was demonstrated truly since March this year was the real importance of those strong partnerships across public sector organizations with groups like Pave Point, where you can form a true partnership based on mutual respect and understanding. And for me, today, has again provided more evidence in terms of how we can build those partnerships and ensure they're stronger and sustained. So I think that's probably it from me, Bridget, but thank you very much to all of the speakers. It was really, really interesting.
Thank you very much, Martina, and we look forward to positive developments in the future in our partnership working. Thank you. Now I would like to introduce Fiona Coyle, who is the Chief Executive Officer of Mental Health Reform, who will respond from a non-government organisation perspective. Thank you, Fiona.
Thank you so much. And firstly, thank you for such an insightful hour. I feel like I've learned so much and have so many ideas in my head from all the presentations. So Mental Health Reform, we're the National Coalition for Mental Health. So we've nearly 80 members, including Pave Point. Just a few points. I know I don't have much time, but it's always worth stating, I think, the need to always recognize that, in society, we don't all have an equal opportunity to grow and to flourish. And, that may seem like a very basic point, but it's one that we always need to keep reiterating. And the risks of mental health, they're also not equally distributed. And in Ireland, we've been going on a big journey in relation to discussions on mental health, and there's been huge strides taken in terms of, talking about it more openly. But for a long time, and I think it continues, that the causes and the discussions of mental health was very much focused on individual factors, and rarely, did we see in public discourse, the circumstances where people were born or live, how those directly affect, our mental health. And we've just recently launched a new policy that does take into account, the social detriments and the impact that they have on mental health. But everything on paper is lovely, and I think it's what Ian was saying as well, is that for change to happen, you need to recognize that there are the different levels, and institutions in particular can be more conservative, and their values are much more deeply entrenched, and they can take longer to change. And as mental health reform, we've really been pushing for years this recognition of the social detriment of mental health. We're delighted that's in the policy, but what next? The ethnic identifier is something we've been pushing for with Pave Point and other partners as well. But unless we have that data, how can we show what is actually happening in our mental health services? I just wanted to pick up, it's really interesting, the whole conversations around colonization, and being Irish, I think we have a very unique view into how we perceive, as I suppose historically being the kind of victims or the recipients of being colonized. We often think that we can empathize, and it leaves us blind to some, in my opinion, to some of our, I suppose, fundamental flaws as a nation in recognizing, some of those kind of racist traits that we have, either consciously or subconsciously. And it's often maybe a barrier to having these broader discussions on, how we need to look at our services, that especially in mental health, mental health and a recovery journey, everyone's recovery is unique. Everyone's mental health journey is unique, and we really need to focus on that kind of difference approach, and to ensure that we're really having really frank and open conversations. Because another trait of I suppose our kind of Irish kind of culture is that we don't talk maybe as openly as we should about some of these, and we don't kind of want to address them, while, you know, empathizing with other movements such as Black Lives Matter, we equally are maybe not as sympathetic for movements for equality and anti-racism within our own country. So I think that's something, you know, we really need to reflect on. Culturally competent services, mental health reform is undertaking a piece of research with one of the community mental health teams in this regard, really looking at, you know, what does culturally sensitive mental health services look like, and what do we need to do. So it's a very kind of, you know, it's a pilot project, but we do hope that it may open up doors to future conversations. And yeah, and I suppose kind of finally kind of back to, you know, we're 5 days away from our budget next week. I think, you know, COVID has been a disruptor. I think, you know, we don't want to go back to how it was. How it was not good enough for a large number of people in Irish society, especially those who were waiting such a long time to access adequate mental health services. So we really need to recognise that it's an opportunity, but opportunities also need investment and funding. You know, if we want to pilot new programs, or we want to really ensure that the services are there, we need the investment. And yeah, just to make everyone aware, over the next couple of days, make your voice heard, you know, ensure that the government knows that, you know, in the week where it's World Mental Health Day, that we need to invest in mental health services, including mental health services for the traveller community. So thank you so much, Bridget. I know I've probably overtalked,
Yeah,
but
sorry. Yeah, thank you very much, Fiona. I'm sorry about that. All right, we're running against the clock here. Thank you, Fiona. And finally, Stacia Quickly, Chairperson Pavi Point, Anti-Racism Committee member, former chair of the UN Committee on the Elimination of Racial Discrimination, to give the closing remarks. Thank you all for your participation. Over to you, Stacia. Thank you.
Thank you very much, Bridget. And can I start by thanking you in particular for your moderation of this event. Thank you to participants for being with us, and particular thank you to our partners for again endorsing the need for an ethnic identifier. I've always said, unless we can measure things, we're not going to be able to manage them, or we're going to pretend to manage them in an ineffective and disorganized way. Thank you to Pavi Point staff in particular for all the work you've done over the last 6 months. And not just in the last 6 months, in uncovering so many issues and so many discriminations against travellers, and more recently against Roma in Irish society. And thank you for the initiatives that you've taken during and since COVID began to ensure that the racism and discrimination and the health inequalities and a number of other inequalities experienced by travellers and by Roma are identified, named and addressed. Particular thanks, though, this morning to the Mental Health Initiative. Your innovative and inclusive work, which was portrayed at the start of this event, and your work on informing policy has led us to today's interactive webinar. And thank you for thinking of it, and thank you for doing it. And finally, can I just say a few words in thanks to Yin. Since 1985, since Pavi Point began, we have named the experience of racism as one which is an experience of travellers in Irish society, an experience which, to put it in the way I like to put it, is embedded in the structures and institutions of this state and virtually every other state, an experience which lives on the legacies of slavery and colonialism, as well as on current slavery and current colonisation, as you so rightly pointed out. I was struck by a number of things that you said, in particular at this point in time, their timeliness. As we move with the COVID challenges, as we move with the intercultural health strategy, and as we think to the forthcoming Traveller Health Action Plan, but in particular for me, as we look to the National Action Plan Against Racism, which the state has agreed to develop and which I'm part of the process of developing, it strikes me that your comment about implicit bias and its link with explicit racism is a very important starting point. Equally, what we would call racism on purpose or in effect. It's not enough to be on purpose, it also can be in effect. And I think your naming of cultural competency in the way that you did, as also a journey to creating motivation to avoid racial bias, is really important. that journey, which also means validating the experience of groups and individuals experiencing racism, accepting their expressions and their anger, and why wouldn't people be angry for that? And also moving to assertive interjections, which ask for clarifications. I thought very useful advice and something that we can begin to do from today onwards. It seemed to me also that you're calling for use of historical, social and political determinants of collective as well as individual well-being is a very important informant of any policy to change. And I think your naming of individual well-being as needing institutional change and demanding reactions to racism which go beyond health and identity is really useful. Can I say that I particularly support your comment about obsolescence and maybe ending some institutional frames rather than just reforming them as being something that's called for if we're to create the truly equal society in this country and elsewhere, and to acknowledge also our own capacity to be racist in Ireland. And that certainly took a long time. And in our experience in Pavy Point, it was only in 1999 that we had anti-racism legislation in the country, and only, as some of you will recall, in 2017 that traveller ethnicity was acknowledged and the associated discriminations explicitly acknowledged, although they had been, to be fair, acknowledged previously also implicitly in Ireland's reporting and reviews of its international human rights instruments. So I leave you with those thoughts. Thank you very much. I hope you all have a good day. And particular thanks to Union for getting up in the middle of the night and sharing your expertise, your scholarship, and your connectedness. Thank you all.
Thank you.